Hi, I'm Jeremy Crosby.
And I'm Nick Boucher. We're the hosts for the program that's all about your city, Talking Fitchburg.
Every day, we pull together the news, events, and information you need to stay on top of what's happening in the city of Fitchburg.
Find Talking Fitchburg on cable TV, Roku, Amazon Fire, Apple TV, and our live stream on the web. Plus, you can view all our headlines and stories on Facebook, YouTube, and our video on demand service. This is your city.
Keep up with Talking Fitchburg and the issues that affect you and your neighbors.
Want to know what's happening in your city? Get Notify Me messages from the City of Fitchburg. Visit fitchburgwi.gov on your computer or mobile device and select the big Notify Me button on the left. Enter your email and/or phone number, whichever is best for you to get notifications. Scroll down the list and select all the topics you're interested in to receive email or text messages about. You'll be notified every time one of your topics is updated. Sign up for Notify Me, one more way to keep up with your Fitchburg government.
All right, I'd like to call to order the November 14th Fitch-Rona EMS District Commission meeting at 7 p.m. Roll call.
Roberts.
Here.
Hilla. Lonsdorf.
Here.
Paul.
Here.
Fusco.
Here.
Kaiser McHenry. Johnson.
Here.
Wheeler. Luganbo.
Here.
Chief Anderson.
Here.
And Deputy Chief Dostalek. Okay.
Thank you. Is there any public comment to report? No. Before we move on to review and approval of the meeting minutes, I would like to introduce a new member of our commission, citizen member from the City of Verona, Stephen Fusco. Like to introduce yourself to the group?
Yeah, I'm Stephen Fusco. I moved to the city of Verona about 2 years ago, and so decided that I wanted to get involved. And I have a little bit of background. I worked in the emergency department for Swedish American Hospital in Rockford, Illinois. I was a medical scribe for about 2 years, so I have some exposure to emergency medicine. So yeah. Just excited to see what we can do.
Thank you. Welcome. Next agenda item, review and approval of the meeting minutes from October 10th, which are provided as part of the board packet, the meeting packet, excuse me. Any questions or comments about those minutes? Seeing none, I'll take a motion to approve.
I'll take a motion to approve the October minutes.
I'll second.
All in favor signify by saying aye.
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 Anyone opposed? The motion passes. The Chief's report.
All right, thank you. You should have got this in your packet. It's posted up on the website as well. I've got it up on the screen for you. Hitting the highlights of the month, you'll see last month was another pretty busy month for us, up 12%. 464 calls for the month of October. That brings us up to an average of 6.2% is our target for the end of this year. It's again just over 5,000 calls. So that'll be a pretty significant number for us. Updating other numbers that we hit here for the month was 19 times last month where all of our trucks were on calls. And then we did add another couple times where the city of Madison had to come in because we were out of resources. So year to date, 37 times in 2024 where somebody had to come in because we were out of resources as we kind of look for that future growth. Runs by municipalities continues to be unchanged, right? It's largely up here in the city of Fitchburg. Like to hit the community events. If anybody's City of Verona residents or kids in Verona School District, their football team, went really far this year. Made it to, I think, sectionals before they were beat. So I did a couple of football games, cross country sectional. Fitchburg Fire had their open house last month. We got a first aid CPR course for Latitude, and then a special shout out to Jamie Ennis, who there's a Verona Girl Scout troop, got their first aid badge. So she actually went over with Jen Roman, from former captain from Madison Fire Department, works at MATC, went out and did some first aid and demoed the ambulance for the Girl Scout troop. So thank you to her. They sent some pictures in, were great. Rest of our statistics there, pretty spot on for what we normally do. You can see our aging there. Our EMS MCE is that new billing company. They're getting our bills out the door within about 48 hours from the time of the call. So we're catching up on all that financial stuff from where we were previously last year. You can see our checking savings account. All of our CDs are in there. We're still sitting okay for the last 2 months of the year. We have some money left in there from our FAP funds from last year, that restricted fund. I did submit the application for the fiscal year 25 FAP funds. The state fiscal year is July through June, so it's always a little weird to wrap my head around that. But if you read any of the stuff through the state legislature, Governor Evers actually put a significant amount of money into the FAP funding for EMS services. So I'm anticipating our FAP money that we're going to see for this coming year is probably going to be 2 to 3 times what we received before. So that'll really help offset some purchases for supplies, maintenance, and potentially go towards an ambulance. Reminder, next year is our contract year, and then our post-retirement healthcare funds. No donations for the month. A couple of milestones for us. Eric Anderson, who's one of our part-timers, he hit his 3-year milestone this year. And then Saturday, the 16th, is actually Deputy Chief Dostelik's 9th year with us. He's celebrating with a cruise. So I'm sure he's not celebrating his 9 years with us with a cruise, but he's got a couple of days left on a cruise, and he'll be back next week off of a 2-week cruise. So I'm expecting his retirement paperwork in when he gets back after being gone for that long. But congratulations to him for 9 years. Other updates, since we met last month, the ambulances got pushed off another month. So they will not be here till January. I am told they are in production though, which that's what kind of moved that target date to January. So we should see those 2 in January to replace what we have that we're trying to keep moving. Update on the deputy chief position. I'm trying to remember what we talked about last month. We had a pool of 6 applicants put in for the first time it was posted. 2 of them had to withdraw for various reasons. Prior to the interviews, when we got to the interviews, we had to actually, the day before, somebody else withdrew for a family emergency. So we interviewed 3. And of those 3, we were interested in moving 2 of them forward. One of them didn't actually meet the qualifications for the original job posting. So kind of talking with the group, as well as the group here, we reposted that for another 30 days. That will close next week. So we've got 3 more applicants in that pool. So that's the update there. We will have panel interviews with that same panel that interviewed the first group on December 2nd. And then I've got it set up for our medical directors and a chief interview on December 12th. So in the next couple of weeks, we'll be able to move forward with that process. Just last week, I think I shared with you early in there, we had one of our medics step down from a full-time position down to a part-time position for essentially personal reasons with a new baby. So Molly Olson, who was we swore in here about 4 months ago, who was our first new next generation EMT paramedic intern. Right, we saw her straight out of EMT school. She was with us for 2 years as she got her paramedic associate degree. Yesterday, or Monday of this week, was her first day. So kind of the program worked out. That was our plan. Our plan was to homegrown some of our medics, and Molly was our first one to make it that far. So Molly is our new full-time medic here at Fitch-Rona. And then just kind of other updates, something we've been talking about for, I think I went back to an email for 2017 with former Chief Stedman and Madison Fire. We've actually been partnering with Madison Fire to help support some of the Badger football games and Badger hockey games. similar to that partnership we've had at the Alliant Energy Center, where we all have those extra events that we're trying to get covered, and just taxing our staff. So they're struggling with taxing their staff, so they're reaching out to the affiliates, and we've actually been able to help them out as they have helped us out as well. So really good kind of examples of the partnerships we got going here in Dane County. And then love to do the shout outs. Got an email back from one of the UW Peds nurses to Jamie and Justin on some phenomenal patient care to a pediatric there. It must have been like Kids Month, because we got Hayden and Ryan Dockery. Same thing, a family wrote in. Thank you very much for taking care of their kids. I talked about Jamie Ennis already. I don't think I shout out enough. Nobody's staring through the window there, but FACTv, I think they kind of go, there he goes. Just a huge thank you to them. So Jeremy, who's the department manager or department director of FACTv, has helped us out with updating some employee photos for us that we've missing for the wall, as well as Scott and Chad, who are always working behind the scenes for us every month. So huge thank you to them. I don't know that we thank them enough. And then again, publicly, Sarah Olson from the city of Fitchburg, our own JR, Chief Eric Lang from Deer Grove, Chief Liza Tatar from the city of Madison, Chris Backus from Belleville EMS, and Deputy Chief John Osted from the city of Sun Prairie helped us with that hiring group. And then Lane and Amy from Fitch-Rona were our employee representatives on that last hiring panel. So that's the better part of a day if anybody's been part of an interview process. So a huge thanks to them. And they got all of, I think, coffee, tea, and I don't even know that we got you donuts, but thanks to them for helping out. And then two other things we got. External thank yous. It was a shout out to Greg and Andrew from one of the Verona PD officers. Wanted them recognized for a family who was involved in a crash, but they weren't injured, but just needed some essentially humanitarian care. So didn't need to go to the hospital, but they actually got him in the back of the ambulance and actually drove him, I believe it was to a hotel where they could wait for a ride to come. And as well as one of the family members in there needed a change of clothes, and it sounds like Greg actually went home and got some clothes and brought it to one of those family members since they were out of town. So great providing essentially the humanitarian support that our crews can do. And then we got a thank you from a family for Chip and Christy that had a kind of a complicated call out of the district that we helped on. Didn't have the greatest of a bit of a poor outcome, but the family was very appreciative for the help that we were able to provide them. So again, like reading the shout outs, that there's some good stuff, other than the FACTv and interviews, none of that came from me, right? That came from other people out in the community who like to recognize our employees for what they did. That's what I got.
Thank you. Any questions for the chief regarding the chief's report?
Can you remind us what FAP stands for?
Sure, it's called Funding Assistance Program.
All right. Especially for
EMS agencies.
EMS from the state? Or?
Yep.
Okay.
So the state of Wisconsin, you have to apply for it, but it's a fairly straightforward process. Every EMS agency, it's a flat amount, and then there's additional funds put on that based on your call volume and your per capita. So whatever that pot of money is defined by the state budget. Once all that flat amount comes out of there, the rest of those are all divided up, and each one of those, citizens or calls becomes worth something, and then that's how the money's distributed.
Okay.
Historically, we see somewhere between $8,000 and $10,000 a year. My guess is we're probably going to see upwards of $20,000. All EMS agencies who apply for it will receive that. It's in the line item as an assigned fund or restricted fund. We can't, it's not Patrick is to spend it on whatever he wants. And it is actually audited. Before I can apply for my next year's funds, I actually have to reply back, submit receipts and actually expenditures and names. There's two pots of money that money comes from. It's training and then support and equipment, I think, is the two of them. So one of them is earmarked for EMT training only within that first year. So that's what we use for our internship program to put our EMTs through. If we don't have any EMTs, we've been able to sponsor EMTs for the fire department through that EMT training. If we don't use it in that first year, we can escrow it, and then we can use it for any training. And then the other stuff that you can purchase for is it cannot be part of an operational budget. It's not supposed to be budgeted at all. It's funds from the state. It can be used to purchase an ambulance, turnout gear, durable medical equipment, training aids, unanticipated repairs, right? So I can't use it for routine oil changes. We can use it to purchase an ambulance. And then as of this year, I don't know where it came from, up to 15% of that can actually be used for disposable goods. I think probably just somebody somewhere recognized that rising cost of our medical supplies, as you see every year in our budget, is insane. So up to 15% of that can be used for supplies. So yeah, it is restricted, and it does get audited as we got to report back.
All right, well, thank you.
Yeah.
I have a question on that. Is that a use it or lose it? You have to use it within the year you get it? I know you can escrow the one.
We can escrow it, yeah. So there are some agencies, a smaller agency up north, they escrowed it for about 10 years and bought an ambulance with it. So it can sit there, and you just have to report that you still got to report you didn't use it, but you still have it. But no, they don't take it back.
Are there other questions for the chief during his report? All right, we'll move on to agenda item 6, review and approval of the accounts payable checks authorized by Chief Anderson, which were provided as part of the packet. Any questions for the chief regarding the accounts payable checks? No questions. Do I have a motion to approve?
I'll make a motion to approve.
Is there a second?
I'll make a motion to approve.
Is there a second? All in favor signify by saying aye.
Aye.
All opposed? Anyone opposed? The motion passes. Agenda item 7, which is resolution 2024-5, approval of the GASB 54.
So I'll just always, there it is, remind you what GASB is. It stands for Government Accounting Standards Board. It's just an accounting measure that says, essentially, we assign it every month, that says there is a bunch of funds in our operating budget every month that you as a commission are designating to me to not spend, in a nutshell. So there's 4 numbers in there, those were mailed out to you, right? The 143, 112 is a non-spendable. Essentially, that's inventory, right? Non-liquid stuff. That number comes from the auditors. $52,114 is non-spendable because it's prepaid expenses. Essentially, that's like if we have a 5-year software contract or something, right? That's money we owe in the future. The sick leave liability, that is the only one that changes every month just because that account accrues interest. So it takes $265,756.17. And we haven't touched contract negotiation funds because that's not till next year. It's $24,000. So you're just approving that those are the numbers.
Any questions for the chief regarding this resolution? Do you have a motion to approve?
Move approval.
Do you have a second?
Second.
I'll second.
All in favor signify by saying aye.
Aye.
Anyone opposed? The motion passes. Agenda item 8, discussion and possible action on 2025 ambulance rates.
So I sent this out into the packet with you. We raised rates about a year ago when we switched over to the new billing company just because they changed away a little bit of the way that we billed before. Took out prior, we billed a base rate, mileage, and itemized supplies. Lots of billing companies or reimbursement companies, to include Medicare, don't pay itemized supplies. So kind of based on the recommendation from our billing company, we just changed our base rates to kind of look at an average supply use per patient per call, and then just up the base rates by that number. So that was last year to take effect this year, or in 2024. So looking at the potential to raise or not raise rates as you seem fit. So Medicare, I have it written down here, the Medicare inflation factor, and don't ask me to explain much more beyond that, is 2.4%. So our Medicare reimbursement for next year, that number that we get reimbursed from them, again, I can charge whatever I want, and I can charge them $1,500. Medicare, Medicaid, there's a couple other groups in there that, based on government, they will only reimburse us for X amount of dollars. The rest of that is written off. Usually that does include some sort of patient copay, but the amount that they will reimburse us is going up 2.4%. Kind of based on some past discussions as we passed the budget last month, or two months ago, we try to keep, kind of was a good goal to set the user fees and municipal, essentially subsidies, at about a 50-50 split, so that user fees paid for 50% of our operational costs. We're currently at about 47% user fees and about 53%, right? Those are rounded numbers for municipal costs. If we raised rates up to 6%. I had Chrissy, who is our salesperson or our customer service specialist from EMS, our billing company. She put a chart together. I asked her to put the chart together. So you see our current rate in there. There's a 3% increase, a 5% increase, and a 7% increase. When I did my math, if we increased by 6%, that would get us closer to that 50-50. That would actually get us to a 49-51%, 49% user fees, 51% municipal fees. So 7% would get us to really a 50-50. 3% would be kind of somewhere in the middle there. If you're interested in the charge descriptions, we don't differentiate. So there's a BLS, an ALS, and an ALS2. I can explain them for you if you want. You probably don't really care. It actually just has to deal with the service that we provide, and it's the reimbursement rate. All the ones that are down there at DOA, it truly means dead on arrival, right? Those are patients that we respond to in cardiac arrest, and we treat them on scene, but we don't transport them. There's a significant charge for that because those patients do generate a lot of supplies during that cardiac arrest process. You'll see the recommendation here is to raise our ground mileage. For paramedic intercepts, that it changes a little bit when we go to, say, Mount Horeb calls us to hop in the back of their ambulance and take care of a patient that we can do something that they can't because we're a higher level of service. We don't charge mileage because the patient's not in the back of our ambulance, but we can provide for that care. Now, Medicare actually only allows one entity to bill for that service. We both can't bill. If a patient has private insurance, we will both bill. Most private insurances will pay that. Medicare will not. So years ago, there's actually an intergovernmental agreement set up with the agencies that we intercept with. The transporting agency is responsible for billing, right? So in this case, Mount Horeb is the one who has to bill for those services. We will bill Mount Horeb a flat rate. All paramedic services in Dane County have agreed to this same rate. I believe it's 65% of the Medicare allowable or something like that. We bill Mount Horeb for that. So Mount Horeb then bills it on their behalf. We get 60% of that. Mount Horeb gets to keep 40% of it, right? And basically the wear and tear on their ambulance, but it still covers our supplies. So that's where that intercept charge comes from. And then TNT, that tier 1 TNT is treatment, no transport. And there's two tiers there. That first tier is treatment, no transport. That's, we came, you fell, you maybe cut your head. So we put a bandage on your head, picked you back up and put you in the chair, and here's $150 for our services. The second one on there, you'll see it's significantly higher. We don't use that one a lot. That's more of a patient who requires some treatment. So my example would that be, say it's a diabetic who we get there, we start an IV, we give them some sugar, or an asthmatic, we get there, we give them albuterol, give them a couple of medications. They're stable enough, right? We fixed them. They don't need to go to the hospital, but we provided kind of a higher level of treatment and care for them. So that's all the charge descriptions. So I guess looking for you or the discussion to have with you tonight, we've got the option to leave our rates the same. We can raise them 3, 5, 7, or if you want, somebody wants to do the math and go higher than that, we can do that. I am sharing with you, based on my math, a 6% increase gets her closer to 49 to 50. My recommendation would be either 5 or 7%, but also understanding, right, the economic times and the populations we deal with, that patients who don't have insurance are still responsible for these same costs.
I'm of the opinion we should probably do the 7, and I mean, if they can't afford it, you've got that form for them to get
Yes. We do have a hardship policy. We do have a hardship form. On the off chance somebody's watching, it is on the website. It's in English and in Spanish. Perspective-wise, we are not the highest by any means. I would say we're top of the middle. Even when we updated these, we kind of went with looking around. We're the top of the middle. There's a lot of agencies around us that are.
Is there criteria?
For hardship?
Is there criteria for the hardship?
Yes. Yep. It just as the basic request of submitting why. It's a 2-sided form, and then it asks for, I think, a copy of a pay stub and a W-2 or something like that.
Do you know what percentage of your patients don't have insurance?
Not off the top of my head, but I can find out for you.
Okay, yeah, I would love that.
When I was looking at this and it came to me, I looked back at the 2025 budget, and it looked like our expenses went up almost like 5.6%. So I was leaning more towards the 5 to 7 also. I just think that when expenses go up that much, I think we have to build to kind of cover those expenses. So I agree with the recommendation. I think 7% would be a great opportunity to at least cover our expenses that are going up.
I agree. 7% sounds fine.
I do too. I don't like any increase, but that's never an option, truly, these days.
If we go up by 7%, will it future-proof us for increases in the future? No, it's okay. Well, if it has to be done, it has to be done. That's the way I feel.
Yeah. Historically, we've only raised rates about every 2 years. That's why I think it was about, not this last one, but the one before that, we did have a significant increase in our rates. Again, and not that I want to compare ourselves to others, but we are not nearly the top in Dane County of what people are charging.
Any further discussion on this item? Do I have a motion to approve? Well, what's the motion? I think you want the motion is 7%.
I make a motion to increase the things by 7%.
Is there a second?
I will second.
All in favor signify by saying aye.
Aye.
Anyone opposed? Anyone opposed? The motion passes 7%.
Okay, just noting those will take effect on January 1st.
As you probably know, so this next agenda item, I need the person who's making the motion to read the words on the agenda as part of your motion. Anyone? Oh, you don't have it.
I'll do it.
You go for it.
All right. I move I make a motion to move into closed session pursuant to Wisconsin statute 19.85 parentheses 1 end parentheses. Considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility, MOU with Local 311 regarding field training officer pay.
Do I have a second?
Second.
All in favor signify by saying aye.
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 Is anyone opposed? The motion passes. We move into closed session. I'm on agenda item 11, discussion possible actions on items discussed in closed session. Do I have a motion for action to be taken from closed session?
I move we approve the MOU with the union. Is that good enough?
I think so.
Right.
Do I have a second?
Second.
All in favor signify by saying aye.
Aye.
Anyone opposed? The motion passes. Other business is allowed by law. Does anybody have anything else they'd like to discuss?
I have a question for the chief. There was a horrible accident in the town of Verona recently. 5 people died in a Tesla that had a low-speed impact with a tree and ruptured the lithium batteries and caught on fire and killed everybody. Did you guys respond to that? Were you involved with it? Was everyone dead by the time you got there, I would imagine, or close to it? Offline, okay. Do you know if anyone's investigating that? You don't need to tell me the gross details, but I think that's a big risk of Tesla cars, and I wonder if anyone's reporting that to federal authorities, essentially.
I have asked that question really out of curiosity, not in my lane whatsoever. And I think, and it was actually just earlier in the week with the police chief, and I think there's just kind of lots of talk. I don't know for sure. I know there's talk, but I don't know.
All right. I could take it up with the police chief or the fire chief, I suppose.
And it actually, so because it happened in the town of Verona,
Yeah.
would be Dane County Sheriff's Department,
Oh,
because that's the sheriff's department.
and we have a sheriff's representative. Okay. I'll do it with her.
There you go.
Yeah.
The city of Verona did assist because it was just outside city limits.
Yeah.
So lots of people involved in the response to that, but I would reach out to the sheriff's department.
Okay. I went down and looked at the scene because I wanted to make sure there wasn't a pothole or a problem with the town road. And the road had just been repaired a month or two earlier, and all the brush had been trimmed off of it. So it was as good as we ever get our roads. So we were not at fault, I guess. Well, thanks.
I didn't get all the information.
There's a lot of woods there. We're lucky.
Yeah. Should go off.
Go ahead.
Okay. One of the town board members is having a Farm Bureau safety thing that he wanted us to mention for Mike Durst. And he wanted us to just let you know, and we'll send you some information. They are actually going to do a couple tractor rollovers and stuff, but it's limited to 60 attendees. So he wants to make sure he'll get us more information for that for you.
Perfect. I have no doubts he will call me and let me know.
We missed that announcement. We haven't had that. Exactly. One other question. Is there anything newsworthy to report on the status of the cost-sharing discussions between?
Sure, I think that's allowed because it's not an actionable item. The group of the city administrators, and I throw Sarah in there, she's town planner or whatever her official title is, and the mayors and Mr. Geller, they met on the 30. It was either 31st or 30th, something like that. That was their second meeting, and this is as of this morning, talking with Chad Brecklin from the city of Fitchburg. They were all given kind of a task on that first meeting. They came back to the second meeting. He said, "Good discussion. Some stuff that needs to still get worked on," and he said, "So now it's I think December, in a couple weeks from now."
Are you expecting someone, Dan?
So there's a
Someone
date.
just pulled up, Dan.
There's a date in December where they're coming back. There is no
Sorry.
no worries. There's no hard and fast deadline when it done by. It's too late. They recognize this year that it's too late to take effect for 2025. So any changes they make will be effective of January of 2026. So over the next essentially the first quarter of next year, they say we'll put that new intergovernmental agreement together that will change the funding structure, the governance. I was told they're not going to take my annual meeting out of there. And probably he said some language to clarify or kind of tighten up the language about should one or two entities want to pull out of the district, kind of putting a little bit more clarification on not essentially how that process occurs, right? Because I think they want to move forward with like, this is what we want to do, but we also want this plan in place in case this doesn't work kind of thing. But to clarify a little bit of that language. So, and I don't even know that will come back to this group. I don't know where it will go, but I wouldn't expect to see something probably till January or February as it makes its way here. I know, again, talking with Chad, he said he had some operational questions to see kind of how that still interacted. We cleaned the language up out of there a couple years ago, but like it still says we have a secretary. I didn't know if you knew that, Sue. You're the secretary of the of the commission. It's a title. Just because it's in our IGA, it doesn't really mean anything. So that's the update. It's being worked on by that group.
Do you or we have any action items right now?
No.
Got it. Okay. Any other questions for the chief on that? Thank you.
Yep. I guess my only thing would be December. Our next meeting would be December. As of right now, I don't have really anything pressing. If we move this forward, that'll move forward. Our budget is passed. I don't have any policy changes. We've got our rates updated. So to me, unless anything comes up between now and then, if the commission does not want to meet in December, I would gladly take that off your calendar.
Sounds good to me.
Happy holidays.
Yay! Yeah. All right. Do I have a motion to adjourn?
I'll make a motion to adjourn.
Motion.
Do I have a second?
I'll second.
All in favor, signify by saying aye.
Aye.
Anyone opposed? Motion passes.